Glad that we can now be here officially and welcome you to today's webinar on the implementation science teams, the funding opportunity for strengthening pandemic preparedness in long-term care. I'd like to begin by acknowledging that we are gathered today on lands that have been inhabited by Indigenous peoples since the beginning. We recognize and deeply appreciate their historic connection to this place, as well as the opportunity to gather together today. I personally am coming to you from Ottawa, broadcasting from the traditional unceded territory of the Algonquin and Anishinaabeg peoples, and feel so fortunate to have the opportunity to live, work, and play in this wonderful place. I encourage you to introduce yourself in the chat, get the conversation started so you know who else is on the call, and while you're doing that, I'll introduce our panel for today. So I'm delighted to be joined by Jane Rowlett, who's the Scientific Director at the Canadian Institutes of Health Research Institute of Aging, by Rick Glazier, who's the Scientific Director of the Institute of Health Policy, Health Services and Policy Research. I'll get it right one day, Rick, also at CIHR. And helping us answer questions, Meg McMahon is also on the line. And also joining us is Lindsay Yarrow, a partner in crime of mine at CFHI, and she'll be sharing more information around the portal and application process. So without further ado, let's jump in and welcome and appreciate our partners in this initiative. So the Canadian Foundation for Healthcare Improvement and the Canadian Patient Safety Institute are the sort of impetus behind the Long-Term Care Plus initiative that we'll talk about in a minute to support long-term care and retirement homes. And joining us in this effort to embed a very strong base of implementation science into this process, delighted to be joined by the Canadian Institutes of Health Research, the Michael Smith Foundation, the New Brunswick Health Research Foundation, and the Saskatchewan Health Research Foundation. Thank you so much for being part of this process with us. Three things that we're aiming to do on today's webinar. First of all, to introduce the program Long-Term Care Plus, Acting on Pandemic Learning Together, to give you an idea of the foundation that we're building from. Then to take some time to introduce the implementation science team's funding opportunity, and to make sure that everyone's prepared to submit an application to the funding opportunity as well. Please feel free at any point to pop questions into the chat, and we'll either answer them as we go along, or we have reserved some time at the end for Q&A as well. So where did this all start? As I'm sure you know, the pandemic hit long-term care hard in Canada. About 8 in 10 of COVID-related deaths in Canada were in long-term care, and that's about double the average across other OECD countries. And as these data were starting to emerge, we brought together, virtually of course, folks from across the country, did a series of about 40 key informant interviews with family partners in care, with health system leaders, with academics, with others, in May and June, asking really about three things. The first, what contributed to where we were then? What contributed to the outbreaks and the situation? That included folks who are working in long-term care and retirement homes, but also partners working with them in home care, in hospitals, in government, in public health. Second question was around what promising practices are we seeing with the potential that they could be adopted in the short term to spread and scale. And last but certainly not least, how are we thinking about maintaining essential non-COVID care for older adults? Because we recognize that many people living in these settings have multiple health problems, and we were looking to see how those health issues were being managed. That led us to a series of 6 promising practices that form the basis of the Long-Term Care Plus program to support both long-term care and retirement homes across the country to adopt promising practices that will help to reduce the risk of outbreaks going forward and mitigate their effects. There are 6 clusters of promising practices that were identified through the interviews that now form the basis of the program. A series of things around preparations, your classic infection prevention and control, training, resources, PPE, testing. Looking at how do we prevent from the beginning. Obviously, there's a whole series of things that can be done in the community, to reduce the risk of community spread, which in turn reduces the risk in long-term care and retirement homes, but also things that we can do within this sector specifically in working with partners. So for instance, promising practices that emerged around simulation exercises, tabletop simulation with partners in a community in terms of, so what would we do in the case of an outbreak? Who would respond and how to make sure that plans are in place? Clearly, healthcare is all about people. So there's a cluster of promising practices also related to people in the workforce to make sure that the capacity and supports were there, both for existing members of the workforce and also those who might be coming in new, who might not normally work in this setting. Fourth, knowing who to call and having that plan in place in case there was an outbreak. So who is available to help respond to an outbreak in long-term care, in retirement homes, and how will that happen? Fifth, that plan for both COVID and non-COVID care, particularly in settings where many people may have received the majority of their care in the community, in clinics, in a hospital, elsewhere. But now that kind of exiting and entering of a home isn't available. So what are the plans in that context? And last but definitely not least, how do we revisit and support the presence of essential family partners in care throughout this process? So those are the 6 promising practices, and effectively what we're inviting homes to do is to self-assess against those practices. Where are you now? Where have you already got systems or practices in place? Or maybe they're not relevant because you only have single rooms in the home, you don't have multi-bed rooms. Second, what are your goals? Where are the areas where you'd like to move the dial in the short term? And then where are the areas where there might be longer term efforts for you? And supporting those efforts, we have a series of opportunities to both share promising practices in an all-teach, all-learn environment, and also to support a learning health system approach based on both data and practices that are coming from teams, as well as, we'll be talking in a minute, about the implementation science approach as well. And last but not least, to be able to connect with others who are doing similar work, to be able to share experiences, learn from each other as we go. So there's a series of tools and resources available. There are webinars on many of those promising practices to be able to share experiences across the country and some international experiences as well. There are opportunities for huddles, so short conversations on a particular topic that's of interest to you that you can join in, share with your colleagues. Opportunities for coaching and mentoring. Maybe you could use an extra helping hand on a particular area that you know you want to move forward. Peer-to-peer exchanges, plenty of those, and a series of tools also to support change. So bringing in tools that may exist in your jurisdiction now. So for instance, jurisdictions that have developed programs around infection prevention and control or standards and guidelines, bringing those in, but also supplementing in areas where you may not have tools available already and be able to share those that exist across the country. And last but certainly not least, the opportunity for seed funding as well to help support you with things like being able to do time release so that people aren't doing this work off the sides of their desk but are able to focus. We're also doing some specific work through a policy lab approach on family presence that's coming up as well. So how does all this work? Well, we did the soft launch in July. We're off and running. Teams are welcome to join at any point through the process. There's no end date to when teams can join. So right now there's already the report that's available from the interviews, the promising practices, the opportunity to complete the self-assessment online, to start to access coaching and seed funding and participate in the huddles as well. So we're off and running and going. There's plenty more if you want to join the process, learn more about Long-Term Care Plus on our website, and we'll pop the links into the chat for those who may not have them available. These slides will also be shared. You'll have the links there as well. So I hope that you'll join us in this process. And as we were embarking on this process, we were also having conversations with our colleagues in the research community about how we might really bring a rich learning health system approach to this initiative, and delighted that Jane and Rick are going to share with you the opportunities that have resulted from that. So Jane, turning it over to you first, and you'll just have to unpause your camera to get going.
Thanks very much, Jennifer. It's an absolute pleasure for us to be with you. I think Rick is actually going to take the first set of slides, so we're going to pass over to Rick, and then I'll come along with the second set of slides.
Thanks, Jane. Apologies, Rick. Over to you.
Okay, well, thanks very much. I hope people can hear me at this point. I want to start by thanking and acknowledging Jennifer and the Canadian Foundation for Healthcare Improvement, the Canadian Patient Safety Institute, our 6 CHR institutes that are participating, and our 3 provincial partners. So we're just delighted to be able to participate in this initiative with the implementation science teams. So you can see on the right side of the slide the partnerships that we have and that we're absolutely delighted about. So our goal with the implementation science teams is to support the implementation efforts and sustainability of the CFHI CPSI initiative that Jennifer just described to you, including the promising practice interventions and policies, to rigorously evaluate the outcomes and impacts of the interventions, and to improve long-term care preparedness for potential subsequent waves of COVID-19. So I will emphasize that these initiatives are meant to be quite short-term. We know there are medium and long-term things that are needed in the long-term care and retirement and related sectors, but this particular effort is really meant to intervene between now and potentially subsequent waves of COVID-19. The value add of the implementation science teams is about supporting implementation in different settings and contexts, and we know that these vary widely across Canada and even within certain communities. We generate evidence on which interventions and approaches are most effective in which settings and contexts and why, and to support the scale and spread to other facilities and jurisdictions, in part through the learning opportunities that Jennifer has described and other interactions that we'll talk about in a moment, and to also develop a common measurement framework project across the implementation science teams. The key information for implementation science teams will go through the objectives, the areas of focus. Jane will talk about the funding, the mechanisms for application, the important dates, and registration. So the specific objectives are here. And you can see that I won't read through all of the details of all of them, but I will emphasize that the implementation science teams need to meet all of these objectives. And you'll see that they're not mutually exclusive. They support each other. So it's about supporting evidence-informed implementation, scientifically assessing the implementation, adoption, and sustainability of the interventions, to understand which approaches are most effective. Building research capacity within this sector is very important, and merely by the presence of implementation science teams partnering with long-term care and retirement homes, we hope to accomplish that. Fostering knowledge translation and exchange throughout the process so that we can foster further understanding of what is working and what the challenges are. Also fostering the use of high-quality, real-time, actionable evidence by the homes themselves, and supporting the development of rapid learning systems in these settings, and applying a sex and gender-based analysis plus lens. So people always ask, do we have to meet all of the objectives? And the answer is yes, but I think you'll see that just doing this work already ticks a whole lot of these boxes. But in your application, we certainly will ask you to address all of these. The implementation science team focus is on the implementation of one or more of the 6 promising practice interventions. I will emphasize that the primary focus of this initiative is on older adults living in long-term care and retirement home settings, and that if a team is working, and teams are required to work with more than one home in different jurisdictions, and if those homes have chosen different promising practices, the team will need to work with them on all of the promising practices that they are working on and that have chosen based on their self-assessment and choice. So the teams will be working very closely in partnership with the homes on the promising practices that they have selected. As Jennifer has described, the promising practices and policies are quite broad, and we think that just about a whole very broad range of implementation efforts and policies will fall under those broad categories. So they're not meant to be restrictive, they are meant to be quite broad. Implementation science teams may support and study the implementation sustainability of an intervention or several interventions, and we suspect it will be several interventions, and or the adaptation scale and spread of an intervention, again working closely with each of the long-term care and or retirement homes. We expect a broad range of different methods. They can be experimental, quasi-experimental, mixed methods, qualitative and or quantitative. We expect that mixed methods approaches will be very common in this space. And we strongly encourage, this probably will not work well without implementation and sustainability and outcomes over time, so that we are not expecting cross-sectional approaches. We are expecting this to be studied over a period of time to understand what's working and what's not working, hand in hand with the implementation efforts of the homes themselves. The common measurement framework all of the funded teams will participate in this framework. Again, we know that there are data gaps in this sector. This is not meant to plug every single data gap, but it is certainly meant to align measurement and data efforts in this sector to form a collective understanding across implementation science teams and their partners about the enablers and barriers, so that we have some common measures of success and intervention impact. The teams will collectively identify this common set of indicators for measurement and reporting. This is to ensure actionable findings. The Common Measurement Framework project will be grounded in the Consolidated Framework for Implementation Research, which has these domains of intervention, understanding the intervention characteristics, the outer setting, the inner setting, the characteristics of the individuals involved, and the process of implementation. And much more detail is available in the funding opportunity about this framework. There is supplemental funding available for one of the funded implementation science teams to coordinate and lead the Common Measurement Framework. Again, all of the teams will be participating, but we realize that having separate support to lead this intervention is important, and it looks very much like, so this will be an optional part of the application. There's a one-page separate optional application to lead this Common Measurement Framework project that will be adjudicated separately from the implementation science teams. So that's the plan. At this point, I think, Jane, I think I'm handing over to you. I'm not sure if I'm doing eligibility or you're doing eligibility, but I know this is our point. Our point of handover is now.
That's fine. I can take over from here. Thank you, Rick.
Thanks, Jane. Please go ahead.
Okay, thank you very much. I hope everyone can hear me. Thank you to our colleagues at CFHI, Jennifer and Lindsay, and all who put together this webinar today. It's been an absolute pleasure to work with you and to bring this funding opportunity to fruition. The structure that you've put in place for the promising practices and now their evaluation from the research perspective, I think will lead to a rich data set and a lot of advance as we move forward. So I'm going to discuss now some of the more technical aspects of this funding opportunity. So eligibility, so obviously, as Rick mentioned just a moment ago, the partners are long-term care facilities and retirement homes, and these homes are beginning to register, and it is important with each application that there be at least that multiple long-term care and retirement homes can be involved, but at least two, and in at least two different jurisdictions. So this is laid out in the instructions for application and the composition of the teams. So the teams are comprised of investigators with expertise in implementation science, as well as long-term care research. And so there will be at least two independent researchers, one identified obviously as the nominated principal applicant, and then other principal applicants associated with the application. To be able to increase training and critical mass and expertise in the area of implementation science as well as long-term care research, we feel that it's important that at least one early career researcher or trainee be part of each implementation science team. There will also be at least one knowledge user as part of the team. These individuals will be decision makers with authority in each long-term care or retirement home setting and will be part of the team. And in addition to that, a resident or family member or caregiver associated with each team. We'll go on now to talk about the funds that are available. So through partnership and our endeavors to pull this together, we have funding just exceeding $1.5 million to fund this research opportunity. That will allow us to fund, we think, 10 implementation science teams, with grants being in the amount maximum of $150,000 per year for 1 year of work. We're hoping very much that we can actually engage other partners as we move forward and before final decisions are made. And if that happens, that would allow us potentially to fund more than 10 implementation science teams. This is a pan-Canadian effort, as Jennifer and Rick have mentioned. And so we therefore are looking at being able to fund teams across the country and engage long-term care and retirement homes across the country. And in a moment on the next slide, I'm going to discuss the regional funding pools that we've devised to be able to allow this to happen. And as a last point on this slide, you'll notice that there's reference to the Canadian Measurement Framework Project. Rick has just described this in detail, and this is articulated also very clearly in the funding opportunity guidelines. And this will be awarded to the highest overall ranked fundable application that has self-identified as having an interest in leading this Common Measurement Framework project. I mentioned the funding pools. So as we are making this a pan-Canadian project, we want to ensure that teams are funded across the country. So to be able to do that, we've split the funding across various regions or jurisdictions in the country, so that at least 2 applications or proposals will be funded, teams will be funded in Western Canada, 2 within Ontario and 2 within Quebec, 1 within Eastern Canada, and hopefully 1 from Northern Canada. In addition to that, that leaves 2 teams available to be funded for the highest ranked applications below that for anywhere in the country. Because Ontario and Quebec were hit hardest in this pandemic, we decided to put some emphasis on funding within those 2 provinces as well. Now let's just look for a moment at the funding for Northern Canada. So the importance here is that the nominated principal applicant hosting an application from Northern Canada has to be affiliated with that region, and at least one of the homes, long-term care or retirement homes, has to also be from that region. So it's important when filling applications to identify the region that you want to be affiliated with. That's determined by the nominated principal applicant, and then that will determine which pool the application will be affiliated with. In terms of provincial partners, Jennifer mentioned that we've been very fortunate to have 3 provincial partners join us. The Saskatchewan Health Research Foundation, the New Brunswick Research Foundation, and the Michael Smith Foundation for Health Research. They have donated and contributed considerable funding towards this endeavor, and that funding will be allocated to researchers, the nominated principal applicant, within that province. So, for example, the funding, just as an example, from Saskatchewan would then be applied towards the successful proposal where the nominated principal applicant is in Saskatchewan, and the same for New Brunswick and for British Columbia. Conditions of funding, there are a number of conditions that we think are important for successful completion of these proposals. And because a learning health systems approach is being applied to this funding opportunity, there are a number of conditions that must be met by all successful applications. The first is to submit brief reports of progress at months 2 and 6 of the research. And this will give a sense for the results that are emerging and the initial lessons learned over time, and then there will obviously be a final cumulative report. There will also be a number of opportunities to interact with other team members. So the first will be an implementation science team building webinar at the start of the funding period to bring teams together to be able to identify their approaches and to share what they consider to be some best practices towards the research. There will also be midterm as well as final virtual meetings to be able to share final results and also share lessons learned. It's also important that that all teams participate in the supportive activities that are laid out as part of Long-Term Care Plus, and participate in the Common Measurement Framework project, regardless of whether they're the lead on that particular project. Several key dates that we have to consider. Registration is mandatory, is required to be able to proceed to submission of final application, and that's coming up very shortly on September 14th. The application deadline, of course, is September 30th, and then the start funding date after peer review of the applications will be November 1st. Registration, obviously, as I just mentioned, is mandatory. That deadline, as a reminder, is September 14th. And so the process is laid out on this slide and also is available on the website. And it's a fairly simple process. It really requires identification of the team members, the principal applicant, as well as the knowledge users, trainees, and other stakeholders that are involved, and the family caregivers, residents, or family member that's involved. The nominated principal applicant has to be identified at this time, and that can't change as the application process proceeds. However, other team members can be added between the registration date and the final submission date. It's also important that information about all applicants and team members has to be submitted, but that does not have to be done through the common CV process. There is an alternate document that will be submitted to provide CV information. I mentioned the regional pools that are important for the funding of applications, so it's important at the time of registration to identify and select the regional funding pool that the application will be associated with, and also to submit some names of potential peer reviewers that would be appropriate for the individual application, but also bearing in mind that these peer reviewers can't have any sort of conflict of interest associated with the proposal. How to apply, there's a long list here, and I won't go into this in full detail because, of course, this will be on the platform for CFA where you apply through CFHI. But the registration and the full application have to be submitted prior to September 30th. Again, many of the same sorts of information that I identified on the previous slide, identification of all participants in the team with the appropriate CV information uploaded, the summary of the research and the research proposal outlined in detail, and Rick identified all of those components that have to be included in the application. So looking at those and adhering to those and ensuring that those are all addressed in the proposal is absolutely critical. Identification by individual teams if they would like to lead the Common Measurement Framework and completion of the one-page proposal on how they would go about doing that. Obviously a bibliography if it's appropriate and the references. Also critical are letters of support. So letters of support from knowledge users at each of the long-term care and retirement home partners, letters of support from residents or family members or caregivers that are part of the team. A budget is critical. I mentioned that the maximum amount of funding per proposal is $150,000 for the one-year period, but there needs to be a detailed budget outlining how that money would be used and the justification surrounding that. And importantly, a list of long-term care and retirement homes that can be involved in the research project are available through CFHI. So at this point in time, I'm going to turn the presentation over to Lindsay, and she's going to take you through details on the CFHI portal where you can submit your application. Thank you very much.
Wonderful. Thank you, Jane. So as Jane shared, the portal is where you're going to complete your registration and submit your application. So I'm going to do a high-level walkthrough today, but if you require any assistance along the way, please don't hesitate to reach out to our team, and we will be sending this webinar recording and the PowerPoint slides along to you later this week. So after navigating to the portal, you're going to need to create an account, and you're going to see that where you see, sorry, my screen just flipped on me there. So after navigating to the portal, you're going to create an account using the register button at the top of the screen. A verification email will then be sent to you, and once you verify this email, simply navigate back to the portal. Once you're here, there's several programs that you're going to see. Please ensure that you select the Implementation Science team as the program that you're applying to. Once you click Apply, you're going to be asked to name your application. In order to streamline the process, we suggest that you name the application the name of your nominated principal applicant. So in the next stage, once you are in the portal, you're going to select the registration form task. You're going to begin filling out this form with the required information. The form is going to lead you through this. It will let you know if you've missed a mandatory field, and it will prompt you to go back to that. You can always save and continue this form at a later time if that's something that you need to do. But once you've completed it, simply mark as complete at the bottom of the page. And once you've done this, you'll receive an automated email letting you know that it's been received by our team. If you haven't received that, please go back into the portal and resubmit that so that you're ensured it's submitted before that deadline that Jane was speaking of. If you need to review or edit any information related to the registration, because you can go in and update team member information as long as it's not your nominated principal applicant. You can simply do this. You'll see the information on the right-hand side. You can edit using the 3 ellipses menu in the top of the right-hand corner, and you continue to edit that information until your full application is submitted. So
So once you've completed your registration, you're going to see at the top of this page that under tasks, you now have the opportunity to complete your application. To do so, you're just going to click on that left-hand side of your screen, and you can now navigate into the form. It's going to let you know that all required fields, and again, it's fairly intuitive to keep going through that and manage through the form. You will have the option to save and continue editing here as well, if that's something that you need to do along the way. Once you've completed all mandatory fields, click Mark as Complete at the bottom of the page. The next step is really important. Once you've marked as complete, it's going to allow you the opportunity to click Submit. Please ensure you submit that application so that it's received by the team by the September 30th deadline. You will receive confirmation that it's been received by our team through an email, and if there's anything that you need to change, don't hesitate to reach out to us before that deadline. So again, don't hesitate to reach out as you're going through this process and walking through the portal. We're happy to help navigate the technology. And I think what I will do is I see lots of questions coming in, so I will pass it back to Jennifer for some questions and answers.
Thanks so much, Lindsay. And I remembered to unmute this time. So, progress in the course of a webinar. So huge thank you to Rick, to Jane, to Lindsay for participating in our panel today. And a big shout out to Meg and to Jess and others, Tanya, who've been answering questions dynamically in the chat along the way. But we do have a number of questions that haven't made it into the chat yet. So I think some of them are more for a conversation. So there have been a number of questions around the different kind of jurisdictions, regions, territories. And so I think there's been questions around, if you have multiple cities but they're within one health region, does that count? What does the North mean? Is it only the territories? Is it broader? So Meg, I'm not sure if you want to jump in, or Rick or Jane, you could wave at me if you'd prefer to answer, just to answer some of the questions on the regional front.
Meg, why don't you go ahead?
Sure. So the goal of the funding opportunity is to support multi-jurisdictional research, and so jurisdiction is pretty broadly defined, as it can be long-term care homes from multiple municipalities, cities, health regions, and or provinces and territories. And so so that provides some flexibility with whom you are partnering and engaging. There were also a few questions around if the NPA for the nominated principal applicant, for example, is from Ontario. Does that preclude partnering with some of the provinces that have funders in Saskatchewan, New Brunswick, and British Columbia? And the answer is no, absolutely not. To access those potential funds, the requirement is that there needs to be at least one principal applicant or one nominated principal applicant from that province, as well as at least one long-term care or retirement home with a knowledge user from that province as well. So lots of flexibility and opportunities to partner across jurisdictions, including with our partner funders as well. Thanks, Jennifer. I'll ask
Meg, before you put yourself back on mute, do you want to answer the question about the North as well?
Sorry, Jennifer, I think I was typing when you asked that question. What was the question about the North I was responding to?
Sorry, that is the hazard with trying to do multiple things at once. So there's just a question around, is it only the territories that would count, or is it also the northern regions of the provinces?
We have defined that in the funding opportunity guidelines as the Northwest Territories, the Yukon, and none of it. However, there is a caveat there in that typically when you would apply to a funding pool, it's based on the location of the nominated principal applicant on that application. And in this case, for the northern pool, there must be at least one researcher on the team that's situated in northern Canada. So that provides opportunity to engage and collaborate across provinces and territories, north and non-north.
Perfect. Thanks very much, Meg. There's been a number of questions around how to connect with long-term care and retirement homes who are participating in the initiative. We have indeed been asking teams as they registered if they're interested in participating in research, and so there will be a list of homes who are interested in participating available. That said, there is absolutely nothing to stop you from connecting with other long-term care and retirement homes who may not have registered yet and inviting them to join in the process. That's absolutely open. So there have also been some questions around the sort of how does this work with the common measurement framework? And I know that there's been some answers in the chat, but I wonder, Rick, if you just want to speak a little bit more about your thoughts on the aim of the common measurement framework and what we're trying to achieve overall with that part of the process.
Sure, thanks, Jennifer, and maybe we'll ask Meg for some of the details after I give them just an overview. We recognize that when having 10 different teams working in different homes in different jurisdictions across the country, that things might not align in terms of what's being measured. And so we do not mean to force people into measuring exactly the same thing. Of course, that will vary depending on which promising practices and policies are being studied, what are the priorities of the homes, etc. But we would like to have some common discussion and common development around some of the core measures and indicators, so there's some commonalities. Again, this does not have to be in lockstep, but so that there's a framework that's being used. There need to be ways to understand the context. There need to be ways to understand what interventions are being and policies are being applied and how their success is being understood. So we need some commonality across the teams so that we understand across the teams what the successes and challenges have been. The specifics are actually up to the teams themselves and the lead team that's taking this on, working collaboratively with the others as to exactly what does it look like, which measures are included, how it's going to roll out, how it's going to be applied. That we're not being prescriptive about any of those kinds of issues, but the intent is that we know there are a lot of data gaps, and we know that even health workers are called different things, or the workers in different homes are called different things in different jurisdictions. So we have the capacity for a great deal of chaos in the measurement set up here, and so we're just trying to bring some order, and also be very helpful to identify, gaps, data gaps, and ideas about how those can be filled. But I know that people had specific questions about the measurement framework. So Meg, if we could turn over to you to expand just on exactly what has been meant, particularly about the framework that we're hoping that people use.
Yeah, thanks, Rick. Absolutely. So just to note also that the Common Measurement Framework project is optional, so teams can certainly apply for an implementation science team in isolation of the Common Framework project. This is an add-on, though we believe a really important add-on that builds on lessons learned from previous funding programs such as the Community-Based Primary Healthcare Funding Initiative. The applications will be assessed based on the IST component, the implementation science team component first, and then the peer review of the Common Framework will be separate from. So there is an additional one-page application, one-page allowance to teams that opt into this component, 2 pages in French. Then we, as Rick mentioned, we have not provided a lot of prescription around the focus of the Common Framework project and the specific indicators that are of interest to teams. That will likely be determined in part based on the promising practice interventions that are defined within the funded suite of teams. But we have required that the consolidated implementation framework is used as the basis for that, because it provides it's an evidence-based framework that has been used to study, to capture lessons learned about the context for implementation of complex interventions. And so that's really the core requirement of the teams. and that there is collaboration across the team. So although one team will opt into and be awarded based on peer review score to lead this project, it is really a cross-team collaboration, and the requirement of the lead team is to collaborate and engage across all of the teams. So I'll stop there and invite Rick and Jane to add any context that they'd like about that. And again, happy to provide more detail in follow-up as well.
Thanks so much, Meg. And maybe we'll move on, not seeing Rick or Jane jumping in on this front. So a couple of questions that have come up that I'll just do quickly and then pass on to the next main question. So there was a question about if a long-term care home or retirement home hasn't already registered but might want to participate as the first step for them to register. Yes, absolutely. You can go onto the website at any time and they can register. There was also a question in terms of whether this funding opportunity will be available a year from now. I think this is a very specific funding opportunity that's tied to, what happened in the spring and wanting to make sure that we're achieving some different outcomes in the fall. So I'm not going to speak for CIHR, but I suspect this will be a one-time funding opportunity. Jane, if I'm wrong, maybe you can say something different in a minute, because there was a question from Jane Coyle that I thought I should pass on to you. So from Jane to Jane,
Okay.
What types of organizations do you expect to apply?
In terms of, I guess it depends where the applicants and the research teams are located. So I'm assuming by what sort of organization you're referring to location of the investigators. That they obviously could be in an academic setting within a university, for example, or within a healthcare setting in a clinical setting, or working within a research institute that is affiliated with or associated in some manner with long-term care homes or retirement homes. So there's a broad area that the investigators could be affiliated.
Thanks so much, Jane. So there's been a number of questions around the 6 promising practices and the specific interventions. So maybe I can take some of the questions on that one. So the hazards of a webinar is you can't put absolutely everything onto the webinar. So for those who are interested in more details, I would encourage you to pull up, it's available on the website now, the link was circulated earlier in the webinar, the report that was done looking at these 6 areas in more detail, and then you can also access the self-assessment for homes. So it is the first piece of the intervention is for homes to self-assess versus those 6 clusters, they are bundles of promising practices, and to identify their goals for change. So it really should come from them, and the expectation is that that process would be completed in conjunction with resident and family partners in care, so that it's nothing for me without me, and the right people are around the table in terms of that process. Maybe this is a good point to answer a question that came up earlier as well in terms of what does caregiver mean? In this context, we really are looking at essential family and friend partners in care. Quite likely that professional caregivers would be knowledge users as part of this process. But for the caregiver component, it really is looking at resident and family partners in care. And in terms of the registration process, so there are actually 2 registration processes. So homes register to participate in the Long-Term Care Plus opportunity, and they may choose either to participate in research or not. Then there is also the process that Lindsay spoke about to register as a implementation science team applicant as well. So I'm desperately trying to keep up with the questions as they're going and as I'm answering them too. There have been some questions in terms of the support letters. I think that was answered in the chat. So Meg, you can shake your head if I'm wrong, that the support letters, there's not one required from the university. There's not one required more broadly. But do you want to just address that specific question? Because a number of questions came up on support letters.
Yeah, absolutely. Thanks, Jennifer. So the only support letters that are required and that will be reviewed are those that are noted in the funding opportunity guidelines. And so just to clarify, the only letters of support that are required and that will be reviewed are those from the knowledge users, from the long-term care retirement homes that are partnering, and from each resident family caregiver that is on the team. So those are the only two that are required and the only two that will be included in the peer review. So, yep, you were right, Jennifer. Thanks.
Thanks, Meg. Much appreciated. There's also been some questions around accessing the list of long-term care or retirement homes who indicated that they were interested in participating in research. The email address to email for access to that list was included in the chat. We have, obviously there will be potentially multiple researchers interested in contacting homes. We will be asking a couple of things. So one, obviously, as you would always do, to be respectful of the fact that homes are super busy. And, this is a time when they are working really hard at the care improvements that they've committed to and just delivering care in a different context than the way they normally do. So obviously we would ask folks to be conscious of that and in the process of contacting them. There will be opportunities for additional teams to register. We're getting new long-term care homes and retirement homes participating every day. So there may be updates to that list along the way. Thanks so much, Jessica. Jessica's just popped the email address in again on that on the chat. So I'm just looking back at my notes in terms of questions. There have been some questions in terms of the composition of the team. So Rick, I'm wondering if you want to talk about the composition of the team and the expectations of that combination of folks with different expertise on the research side.
Yeah, thanks, Jennifer. We really are hoping on the research side that we have a researcher very familiar with implementation science and a researcher very familiar with the long-term care sector. And those may be the same person or they may be different people. By implementation science, we don't mean something very narrow. It could be something quite broad. So people who have been trained in evaluative research methods, clinical epidemiology, broad range of social sciences, health economics, and other areas. You may not call yourself an implementation scientist, but you probably have the goods and methods to apply to implementation science. And of course, in Canada, we do have people who self-identify as implementation scientists. So the ideal combination would be an implementation scientist, a scientist who has experience working in this sector would be ideal. Certainly an early career researcher and a patient or patient-resident caregiver. And by that we mean like a family kind of caregiver, not a professional caregiver, I think which Jennifer clarified for you. So, and of course, we already said there could be multiple PIs, so there's no limit on the number of principal applicants, because that came up in the chat as well. So that's kind of I would say, the composition of the team. Of course, once those teams are functioning, the homes themselves and the ways that they're implementing the interventions, they will be core partners as well. And so the letters from those folks are really important as part of the application.
Thanks so much, Rick. And with that, I think as I've been working through my notes, I think we've answered the questions that have come in, either in the chat or orally. But we will be doing a scan of all of the chat afterwards, just to make sure that we haven't missed questions along the way. And there will be an opportunity as we circulate the links from this webinar to fill in any gaps that we might have missed. So please keep your eyes open on that front. And just wanted to say a huge thank you to all of my fellow panelists, to Meg, to Jess, to Jessica, to Tanya, who've been rapidly answering questions dynamically as we've been going through the webinar, to everyone who was tolerant of the fact that I forgot to unmute at the beginning of the webinar as well, and also to everybody on the call. I think all of us in Canada have read, have learned, have heard about the situation that happened in long-term care and in the older congregate living settings for older adults in the spring. And we owe it to all of those affected then to learn from those experiences and be able to continuously improve the care and the environments that we can provide. So a huge thank you for your interest and your engagement in this process. I hope that many of you will consider opportunities for applying. And you'll see that there's a couple of questions that will be popping up shortly for you. So you asked us questions, we're asking you a couple in return at the end of the webinar. So with that, thank you very much. Merci tout le monde, and have a good rest of your day, whether it's morning or afternoon where you are.
Ladies and gentlemen, this concludes today's conference call. Thank you for participating. You may now disconnect.